It gives me a great pleasure and honor to introduce a very special person whom I've heard about a lot, but this is the first time actually to meet her and introduce her. This is Dr.Rand Askalan, is a pediatric neurologist and a neuroscientist with extensive experience combining scientific research, clinical practice, and leadership. She devoted her career to care for children with neurological disorders such as epilepsy and stroke. She committed her breadth and depth of experience to bridging excellence in child health care in Palestine. She's a graduate. Her bachelor degree is on medical lab technology from the American University of Beirut. This was followed by a master's degree in biochemistry from the American University of Beirut, and then a PhD degree in Neuroscience University of Cambridge in the UK, and then an MD degree from Faculty of Medicine, University of Toronto, Canada, followed by FRCPC in Pediatric Neurology, University of Toronto, Canada, and more recently at Executive MBA, Ivey Business School, Western University in Canada. She's the founder and the CEO of Palestinian Center for Excellence for Brain Development, Tech Queen in Palestine, neurology consultant for the last 10 years at the Hospital for Sick Children in Toronto, Canada, a pediatric stroke specialist, published more than 40 papers in basic and clinical research, founded the Palestinian Healthy Child Fellowship Program in Toronto, Canada, to train Palestinian pediatricians in pediatric subspecialties. It's an honor to welcome you, Dr. Rand. Tfaddali.
Thank you very much for the organizers for inviting me to be part of this workshop, particularly my longtime friend, Dr. Shaheen. She wanted me to talk about my experience in kind of coming back to Palestine and establishing my work here, whether in like building a health institution and also establishing a training program for Palestinian pediatricians. So that's what I'm going to be focusing on. The relationship with Palestine does not come by default for Palestinians like me, who were not born or raised here, but lived all their lives in the diaspora. Rather, it was built gradually over the years and at different stages of my life until the bond got so strong to the point of giving up my life as I knew it, particularly in the last 24 years in Toronto, Canada, where I had raised my two boys, built my career as a neuroscientist and a neurologist, made many lifelong friends, and enjoyed the stability of living in a nice place like Canada. Giving up all of that to be in Palestine and start a new life here in the pursuit of a better healthcare for Palestinian children. The turning point really in my relationship with Palestine was when I came to Jenin on a medical mission after the 2002 Jenin camp massacre. During these 6 weeks, I visited and established a network in the medical community, particularly the Pediatric Society. I then started doing individual and frequent visits, about 2 to 3 times a year. The aims were medical need assessment in general and pediatric neurology clinics and teaching all over the West Bank and Gaza. The first thing I noticed was the scarcity of pediatric subspecialties. There was plenty of good general pediatricians, but it was very difficult to access specialized care when a child needed a pediatric cardiologist or a pediatric nephrologist or a pediatric intensivist, etc. So I was working at the Hospital for Sick Children at the time in Toronto. It's an iconic medical and academic institution in pediatric medicine, where pediatricians came from all over the world to train in pediatric subspecialties. So why not Palestinian pediatricians? After many meetings and negotiations with the hospital, I launched the Pediatric Healthy Child Fellowship, the Palestinian Healthy Child Fellowship Program. And this was in 2010. Through this program, Palestinian pediatricians would apply to the fellowship and go through a selection committee for funding. If approved, they would apply and get accepted based on their merit to the specialty of interest in Toronto. I secured the funding for this program through donations from the Palestinian, Arab, Muslim communities in Canada. The program is still running, and now we have about 16 graduates from this program so far at a total cost of about $2 million. There are 2 fellows in training now in Canada as we speak. The only condition for these fellows was they had to come back to Palestine to work and serve the children as soon as their training is over. That's the only condition. And if they don't, there are financial penalties that they have to pay if they don't come back and work in Palestine. This program had and still has great impact on raising the bar of child health care in Palestine by bringing these highly qualified doctors to care for the children. And this has really made a huge difference. Now we have many subspecialties in pediatrics in Palestine that weren't even available a few years ago, before the beginning of this program. The second project that I would like to talk about is the Palestinian Center of Excellence for Brain Development, TAQWEEN. TAQWEEN in Arabic is, I think the closest translation would be Genesis. The vision of this project started to crystallize in my head around 2015 and 2016, at which point I had done a lot of neurology clinics in Palestine and had a very good understanding and firsthand experience of the dire need of high quality care for my patient population. The value of my sporadic clinics and the reward from doing them started to fade really over the years, because the issue became, how can I make a difference in the care of and services provided to the children with neurological and behavioral disorders in Palestine in a way that is comparable to that is provided to my patients in Toronto. In other words, a multidisciplinary care that actually addresses all the physical and cognitive needs of the children. I soon realized that a project in this magnitude will require my full attention and time. In other words, giving up, being separated from my children and totally move to be in Palestine. And that was the big decision made in 2017. I really arrived to Palestine in this time to stay, not to visit only, with only 2 things: a vision or a dream and the support of my late father, to start a journey of building TAQWEEN. It's a grassroots project. I've started it from actually scratch, nothing except an idea in a country that reasonably it's the first time I come and live in Pakistan. In other words, I had to establish networks, not only in the medical field, but also in almost all walks of life, such as real estate, engineering, IT, legislation, governmental and non-governmental institutions, business people, financial institutions. I had to raise $4 million. I had to understand the geography and the distribution of the population to decide where would TAQWEEN even be, which city in the West Bank. That was all fine, and that was not easy, but I think the hardest was, and the most difficult part, which also TAQWEEN's success hinges on, is finding the right skill set, finding the professional expertise that were needed to form TAQWEEN's professional team of therapists who would not only provide the best care, but would take that care to the next level and fill the huge void in the care of our young patients. Just the way I want it to be, and it should be, in terms of multidisciplinary care. 2 years later, specifically March 2019, it took 2 years. 2 years, I think I stopped being a doctor or scientist. I became somebody who works in construction. I'm always on the site. I'm always making sure the construction is going on in the right way, the right colors are picked up, the right infrastructure is there. I was with the laborers 24 all the time, 24/7 when they're working in TAQWEEN, and I was involved in every single tile that was put in the building. 2 years later, March 2019, Takween's opened its doors to receive our patients. Here, I would like to share with you a short video. It's only 2 minutes that will show you what am I talking about. So this is basically Takween, as you saw, has multidisciplinary clinics. We address the needs of the children from all angles, cognitive and physical and educational. We use internationally known diagnostic tools, especially for the behavioral disorders. And as I said, the team, they were like, I really cherry-picked them when I was establishing the center, and also provided extra training wherever available for them to be the best in their jobs. Now we are close to 3,000 kids went through Takween since we opened in March 2019. The Corona year wasn't easy, especially for a newly founded center like Takween. So we basically celebrated our first anniversary, and then they declared a state of emergency as we were going home. So it was, 2020 was pretty tough, and it was really hard to keep Takween going with all the financial difficulties of the kids and their families. But we're still here, we're still working. I think moving to Palestine, it was not a walk in the park. I had to tolerate and cope with a lot of changes. Coming to Palestine as a visitor is certainly very different from being here and living here. There are a lot of social issues. Some are related to being under the occupation for 70+ years. However, there are two key things that I think one has to have to walk the kind of journey that I walked, other than determination and persistence, that comes without saying. The first thing is the unshakable belief in the value and impact of what one is going to do, to the point that giving up is not even is unthinkable, is not an option. The second thing is a passion for wanting to be in Palestine and wanting to be among the Palestinians in their daily struggle to defend their humanity. Life here is not like waking up and worry about the traffic. It's much more difficult than that. Of course, there are moments of doubt. Of course, there are moments where I thought, did I really do the right thing? Did I really make the right choice of coming here? Of course, and there were a lot of damn moments and doubting. When I feel like this, I go to reconnect with the land. Meaning, I go on a hiking trip in the Carmel Mountains near Haifa. I will walk the streets of the old city of Jerusalem to smell the walls and spices. These little getaways that I take reminded me every time how blessed I am to be in the land where I feel I belong the most. Thank you for your attention.